In this video, we'll be reviewing the interim update for Etomidate and Versed for RSI. Overview. We'll talk about the ketamine shortage and expected return. We'll review both Etomidate and Versed. We'll look at the RSI induction update utilizing Etomidate and Versed, and then just some final notes. In reviewing Etomidate and Versed, it'll just be the highlight reel. All the dosings will be specifically for RSI induction only. All right, let's dive into Etomidate. Etomidate mechanism of action, it's thought to work on GABA, and reminder, GABA is the major neuroinhibitory system for the body. For dose, looking at 0.3 milligrams per kilogram, onset 15 to 20 seconds with a duration of 3 to 12 minutes. I generally think about it as working for about 6 minutes. Some additionals for Etomidate. Relatively hemodynamically stable, but not always. Certainly more than Versed. Next, there is potential for adrenal suppression. This happens by blocking the final enzyme conversion of cortisol. So how that means is a few days after this, there could be some potential hypotension that the facility has to deal with. This has pretty much been solved by administering Solucortef. Not for us, just something to consider that it's not really a bad medication anymore, as that we have a fix for that potential hypotension. Next, Versed, also mechanism of action is GABA. For dosing, we're looking at 0.1 milligrams per kilogram. Onset, 60 to 90 seconds with a duration of 15 to 30 minutes. Some additionals on this, it is dose dependent for the hemodynamic effects. So if you give somebody 1 milligram, an adult, the likelihood of hypotension is very low. If you give pretty much anybody 10 milligrams IV push, there will be hypotension. This happens by reducing the systemic vascular resistance, aka dilating the vessels, so the pressure drops. Little good thing about this is there's approximately 30 minutes retrograde amnesia. So anything happened 30 minutes before you gave the medication, they'll likely forget. RSI induction update. This is the key to this video. Because both of these medications can cause hypotension, we wanted to give you a system to utilize when administering these medications for RSI. The systems are slightly different, so we'll go through them. Etomidate is based on blood pressure, whereas Versed is based on dosing. The Etomidate pressure dosing is really kind of the same as we've been teaching for use of ketamine as well. Because Etomidate is much more hemodynamically stable in comparison to Versed. That's why we're doing it based off of pressure versus just off a dose. So for Etomidate, if you have a systolic blood pressure that is less than 110, please give 10 mics of push dose epi. If the systolic is between 110 and 150, we're going to reduce that to 5 mics of push dose epi. For Versed, if you're giving 5 milligrams or less for induction, please give 10 mics of push dose epi. If you're giving more than 5 milligrams, give 20 mics push dose epi. Please note that both of these medications must be given over at least 1 minute of time utilizing a stopwatch so that you are accurate. And then also the first line induction agent is Etomidate. We want to use that first. We're only going to use Versed if we run out of Etomidate. For post-intubation sedation, we will be using Versed. If you do not use Versed for induction, so you use Etomidate, what I want you to do is I want you to give 5 milligrams IM utilizing the lateral thigh. We should always use the lateral thigh for IM injections because it has the fastest absorption. Versed for post-intubation management is 2 to 10 milligrams per hour. I want you to start at 5 milligrams per hour and titrate up or down to a RASS goal of -4. Because Versed is so vasoactive, means that it can cause hypotension, we need to prepare Levophed. Have it mixed and ready so that all we have to do is hit start on the pump if we need it. For some education updates, I want you guys to practice this on your own, and we will be doing this in person when Hodnick is here on August 30th and 31st if you would like some hands-on update. We'll wrap up this video with some notes. First, this is a temporary interim change as ketamine is on national back order with the projection to return in the beginning of next year. This is simply a projection. We need to learn this in case this becomes a longer-term solution to the ketamine shortage. Next, please continue to use ketamine as the primary induction agent for all pediatric RSIs. Please utilize Etomidate Versed, this new system, for all non-hypotensive adult RSI patients. That way we can save what ketamine we have or prolong the stock that we have to use for pediatric patients or in the very shocky hypotensive adult patient. We'll be adding a 50 milligram Versed vial to your narcs. We will be putting this vial in a plastic bag with an orange medication sticker on it and an RFID tag so that you don't mix up the 50 milligram vial with the other vials. Last thing, Etomidate and Versed have no pain coverage. We need to give some pain coverage to people who are intubated. So I want you to load with 100 micrograms of fentanyl and then 50 micrograms every 30 minutes. So how this works is you would perform the RSI, and then when you start the drip, give 100 mics of fentanyl, and then start your every 30-minute 50 microgram pushes. This concludes the Etomidate Versed RSI induction update video.